So again, welcome to the Be Better Club for our session today. We talked about this a little bit last year, and it's a topic that keeps coming up in these really subtle ways. But we want to talk today about what a colleague of mine from Penn State, Jonathan Marks, called public-private partnerships. And I wanted to address this session for a couple of reasons. One, we had Professor Marks here last year, Dr. Kubler, I think, to give a talk in person on his book, which is The Perils of Partnership. And so that'll give you a sense of his perspective on this issue. But then more recently this year, Dr. Kubler hosted Justin Moran, who is a research scientist with Pfizer who helped develop the vaccine, and talked a lot, of course, about public-private partnerships, but in a sort of secondary way, because they were focused on the science and vaccine development and policy. But there are big questions here, right? There are questions about bias and conflicts of interest, but also efficiency and support, and the way that these things can bind us together and also break us apart. And so I really wanted to talk with you a little bit about this idea of public-private partnerships. And what I'll do is I'll give you, well, I might ask Dr. Kubler, although we didn't talk about this, so I'll put you on the spot a little bit, to sort of give us a short recap of what Moran's perspective was in his talk. And then I'll offer a little bit of framing around Jonathan Marks' perspective. I linked up both of those things in the email reminder, but also in the schedule. But I think just getting us all on the same page about those two perspectives will help us kind of frame the problem. Steve, I can go first if you need a minute to think or prep, or you're welcome to go.
I can say a few things and then we can switch back and forth. Dr. Moran comes from a strongly technical background, and he led the team that developed the methods to scale up the vaccine. So the vaccine was present, but the question is, how do you manufacture it in mass quantities so that it can be distributed on the levels of billions of doses, which of course has great saving potential and also economic impact, hence the potential for conflict, right? And of course, he acknowledged one of several vendors, but was, I think, reasonably quick to point out that they were not originally part of the Project Warp Speed, I guess it was, which was on the front end funded by the federal government to develop the vaccine. So the company took the position to kind of go it alone. And as he pointed out, therefore took some risk and maybe you could argue position themselves a little bit separately from some of the conflicts that might arise in a private-public partnership. But then he pointed out, the effectiveness of the vaccine. He pointed out and described a lot of the challenges there were associated with vaccine hesitancy and where that originates. And so there was some discussion of that. But then, of course, promoted the product and promoted it not just as a representative of the company, but as a developer of a technology which he sees, and I think the data support is incredibly efficacious. He made statements about how they are seeking to provide it more widely, especially to underdeveloped nations, but acknowledged also that the order of revenues, the revenue that the company generated is probably on the order of tens of billions of dollars at this point, right? So it was a rewarded risk, which is inherent in private companies, and pointed out that now that this technology has been demonstrated and they're committed to it, they're trying to develop a wide range of vaccines using the technology. Therefore, this is a foundation, if you will, for further private-public partnership, or at least leveraging that technology and that experience for further revenue for the company. So, it's a home run on the back end of it in the fact that many people benefited, but whether they did or not, many people will pay for other products that come out of this as the company takes advantage of a lower barrier that there was to introducing this comparatively new technology. Not a new technology from the standpoint of the science that went into the COVID vaccine, but new from the standpoint of being very rapidly approved under emergency FDA approval for distribution that lowered the barrier and made it possible to generate the data which showed how efficacious it actually was, which positions this company to actually make a lot of revenue, right? So there's some interesting points there about how the risk reward ratio may have been changed in this case for this company, by the pandemic itself, by the circumstances, and then ask, I guess, questions to be asked about what does the general public get out of it, because the revenue generated pretty much is federally supported. And then more questions can be asked about, what is the global impact really of the technology developed by Pfizer or others, given that it's pretty much benefited, first world nations, and only now are they really starting to look at wider distribution. And we know that, Africa and poorer nations suffered tremendously with death rates and such, due to the absence of the vaccine. So there were some very interesting questions from the audience. I really recommend that you go and look for that video. It's also available on the UCF Center for Ethics website and our YouTube site, and it's about an hour long, but it's a fascinating look at the technology that went into this, as well as some of the questions that spontaneously pop up, if they haven't popped up in your mind already, about some of the ethical implications. So Dr. Beaver, please add to that wherever I've left gaping holes.
No, I didn't see any gaping holes. I want to make sure everybody, before we move on, everybody's comfortable enough, and you all might know a lot more about this than I do, but with Operation Warp Speed and how the government set up to advance vaccine development, if anybody has more detail, I can add in a little bit, but if anybody knows that story better than I do, feel free to weigh in here. I'm going to post in the chat the link to Moran's video too, while I'm at it, so you can watch that later. I'll add in just a little bit more of what I know, and folks can course correct if I'm missing bits and pieces here. But Operation Warp Speed was in response to the COVID-19 pandemic, functionally a race to the finish line. It lowered barriers to vaccine production and put companies in competition. Friendly competition, we would hope, for the sake of public health, but in competition to use federal funds to develop vaccines. And so what Moderna and Janssen and Sanofi and Merck and Pfizer, BioNTech, a bunch of companies were involved in this kind of, I almost said arms race, and that puts us on a different footing, but on this sort of race to develop a vaccine. And it is the case that Pfizer might have been alone. I've lost some of the details here, but no, Pfizer and one other company, I think Novavax.
BioNTech. It was BioNTech, I believe.
Yeah, well, Pfizer, BioNTech as one unit developed a vaccine, but then there was a second company, I think it was Novavax or Novatech or something. Anyway, there were a couple of companies who didn't accept federal development funds. And yet, I'm going to post this in the chat too, the congressional report in late 2021 laid out how much money these companies had received from the federal government, and Pfizer is at the top of that list. They received $5.97 billion in a federal contract for 300 million doses of their vaccine. Now, again, this wasn't money to develop the vaccine, but it was money, kind of a reward for developing a successful vaccine. Reward is too strong. The federal government bought and owned doses to distribute to the American public. So it's an award in the sense that, like, Pfizer BioNTech won the race, right? They developed the most efficacious version of the vaccine in competition with only one or two other companies at that point, and so stood to earn a lot of money. And the 5.97 billion in this congressional report is just for that initial 300 million dose contract. As Dr. Kubler pointed out, they've made lots more money selling other vaccines to other nations and other groups in the US, and also stand to make a lot more money on the back of their technology. And they don't owe the federal government any intellectual property rights. And I'm not sure what that relationship was, if there was such a relationship worked out with other companies, because they didn't take development money. So it's really interesting. And that got me thinking about public-private partnerships. And what I want to say first is just what I'm not setting us up to think is that there's anything necessarily unethical going on about Pfizer and the vaccine development. I kind of want to set that aside, but it's a compelling example of the ways that public-private partnerships develop. And it made me think of Jonathan Marks's talk, because Marks is a bioethicist at Penn State, and his book focuses on public-private partnerships in public health. Now, he wrote his book before just before the COVID-19 pandemic, so it didn't really address this. His examples were more market-driven. So he talked about, for instance, soda companies funding anti-obesity campaigns and those sorts of public-private partnerships, where it seems like there's a conflict in those relationships. And so he built this really interesting argument. I'm going to lay it out for you in as simple terms as possible, and you can also watch his talk later. But he tells us a story about private partnerships and the way that antitrust legislation regulates those interactions, right? So antitrust laws is about the way that private companies interact with other private companies. And then we've got separation of powers legislation and ethos that regulate interactions between public and private interactions. Public and public interactions. And so his question is, look, we've got infrastructure, regulations and rules and cultures that govern those two relationships, but not anything really that governs private and public partnerships. And so he goes on to argue through a series of examples and his own work in bioethics and public health that all else being equal, we ought to hold at arm's length private companies as public institutions. He thinks there should be a distinct separation, not an intentional or obvious interplay, but a separation. And then, his book comes out. We invite him to give a talk. He talks about his book, and then the pandemic happens. And what happens? Well, it's an intentional public-private partnership. And as Dr. Kubler pointed out, to really, really good ends, like almost unimaginably good ends. Right? Wasn't the case that we ended up with a vaccine with only 40% efficacy or 20% like the flu vaccine, but we had a vaccine that worked, right? Saved countless lives. So it's interesting to me, and that's kind of the point. What other examples do we have of public-private partnerships, and why do they occur, and when do they work, and when do they not work? Marx argues they just shouldn't, but we have an example, at least one, of when they really worked well. Yeah, Jason.
I'll go. When you
Yeah.
ask what are some examples, I think about tech companies partnering with public institutions or secondary schools. For example, like Google and Meta, Microsoft, Apple all have ties to universities and are sponsoring research or participating in that, recruiting from them, making their technology available. Like as a student, I get a discount to different cloud software. And so that's just one example. And is it useful? I mean, yes, I like having discounts and opportunity to work on bigger things. But these are like some of the world's largest companies, right, as well, in a faraway place. Is it fair competition? Are there smaller organizations in the state of Florida that maybe I can get an even better opportunity that I didn't know? But just the size of something. So I wonder if, I don't know of bad examples, let's say, where that's failed, but certainly it's happening, and they have an incentive to put their name out there, especially in middle and high school, because of the pipeline of computer scientists itself is not meeting the demand as well. And there's a lot of energy into that.
Yeah, Jason, that makes good sense. And I think we can all imagine any number of UCF relevant examples of just those sorts of partnerships. So I want to talk more about the ethical implications there. Shelley, I see your hand. Go ahead.
So I'm going to jump off on a conversation my students had in class last night, talking about trying to find housing for next semester or next year, and going on across the country. It's not unique to UCF by any means, but a lot of student housing has been outsourced to public-private partnerships. And it's creating a situation where, from an ethical standpoint, one has to question, have these companies been put in a position to take advantage of students? Many charge rents that are above market value for traditional housing to a population that is less sophisticated in their ability to negotiate leases and find housing. We had situations like, I think it was the University of Tennessee a couple of weeks ago, had students and their parents camping out overnight trying to get a spot in a preferred residence hall for 23, 24, 10 months early, essentially. And a lot of the new development was fueled by public-private partnerships in that sector. So I think talking about guardrails that should be put on the market forces for how companies that receive a public benefit are able to conduct business is important. And even thinking about Pfizer announced, and I realize they're kind of in a unique situation. They didn't take the development money, but they certainly were the beneficiary of some really big upfront contracts. They announced their private pricing for the COVID vaccine a week or two ago. And it is nearly twice what they've been charging the federal government. And they're in a position to be able to charge it because it's been deemed effective. And so the burden of that is going to fall on private insurance, who is obviously going to negotiate a lower rate. And then the uninsured or have insurance that don't cover vaccines are going to be paying the full $130 a dose price of the Pfizer vaccine. So as a business instructor in the College of Business and working with what market forces look like, but also trying to balance the ethical of how do we make sure that the companies that receive the benefit are not in a position to use undue influence in exerting that market leader position they've been granted as a result of that partnership.
Yeah, those are great examples, Shelley. The housing one breaks my heart because I know so many of our students and colleagues are sort of in that same boat, worried about housing costs. And the example of medical costs in public insurance relationships, also really relevant. I think I like to remind us that ethics is usually the study of value conflicts. And the value conflict that I think Marx is pointing out most directly is corporations exist to make money and public institutions exist to support the public good. Now, that's probably too fast and too easy, and we could have a conversation about it, but I think Marx thinks that is a fundamental and unyielding value conflict, and that partnerships are always going to prioritize one over the other, and when leverage comes into play, money wins out. So Shelley, your example of housing, I think, is a really telling one there, right? That when we outsource housing, we lose control over keeping it affordable. All else being equal, housing vendors are out to sell housing and make a profit doing so. And if they can do it, they're going to do it. And so, yeah, the idea that we could, in theory, put constraints on market forces through public legislation or regulation is good in theory. And sometimes that does work out. But on my take anyway, maybe Marx's take, and Shelley, I would guess on your take too, usually private forces move much quicker than public regulation. And so there's always kind of a catching up period where somebody says, oh crap, like lots of people are homeless and or don't have sufficient housing. And so now we have to intervene, but then it's too late by a generation. So these value conflicts are really important. But again, like I don't want, part of the goal for the session, I think, is to sort of weigh the costs and benefits of these partnerships. And it's easy for me, because I tend to be an eternal pessimist, to see the downside of these partnerships. So I want to just make sure that we're finding some balance in that conversation too.
Well, and I guess I'll throw the balance in there. In many cases, and thinking about it from, and I know you and I have had this separate conversation about the core value of a corporation is to make money, and it owes a fiduciary duty to its shareholders to return a profit. So there's no disputing on that. And we can argue where that boundary lies, but we can't back away from the fact that corporations are by their very nature profit driven. And to the flip side of that, part of the reason universities around the country turned to private partnerships is they didn't have the funds. They didn't have the funds to keep up with the demand for student housing, and turning to the private sector allowed the housing to be built better and faster than they could have done relying on governmental sources and donations. So there was a valid public need for it.
Yeah, that makes good sense. So this was the second question I had on my list to ask you all, is why do these partnerships occur? And Shelley, you pointed out one reason is because of, let's just say, historical decreases in public support for public institutions. So institutions with needs for the public good turn to private corporations in order to meet those needs, and sort of weigh the risks there, but hope for the best outcome. Sterling, in the chat, you gave us another example, which is universities and the NCAA, or athletics. So there's another example of public-private partnerships. This came to a head in Florida this past year, or nationwide, but in Florida too, where I can't remember now if this was a Florida law or a nationwide law, but now college athletes can sell their own image, can market their own image. And so now there are really interesting, where there used to be constraints on public-private partnerships in that way, now student athletes are smack dab in the middle of it, trying to negotiate contracts with private corporations to make money while at the same time doing their jobs as student athletes. So yeah, I think this is really, this is a really important part of this session for me, is just trying to see what the landscape looks like. And we're coming up with all kinds of really compelling examples.
Another example, which I guess Jason kind of talked about, but Microsoft partnering up with, for example, Washington University, what they labeled it as was like discovery science, that merging forces enabled them, they're looking at, using DNA structures and, structures that have been tuned by nature for, countless years. They're now using it in order to store data super efficiently and take up less space. So they're using DNA and nucleotide structures to do that. And they just said discovery science, and they know that it might not yield something that we can use in the next, couple of years, but they think that, it's just like doing like Apollo missions and stuff, that you get so many practical applications out of discovery science, and you expand that realm for people and like let them know that there is a limitation there, but it's there to be pushed as well, and try to see what we can find out.
Yeah, Natalie, that's a great example. And I hear you, and you can correct me if I'm wrong. I hear you couching this in largely positive terms, right? That there's this relationship between WashU and Microsoft, and there's potential there. There's discovery potential, hence the name Discovery Science.
Yeah, I guess you could say a little bit of a positive. Obviously, I think that the funds could be better put into other places, and that's a conversation for another day. But inevitably, discovery science is something important. It is something that we should be pushing forward. Yeah.
Yeah, so I want to sort of direct our attention down to that very specific, let's call it a use case, the relationship between private support at public universities. So there's a lot of examples of these. Natalie and Jason, you both pointed out some. There's a lot of examples of these across the country and at UCF too. And historically, there's been some examples of risk. And again, this is not my area of specialization, so you all might help me out with examples, but it has been the case in the past that that private support for university education brings with it some bias, right? The idea that if, I know there are some examples from a colleague of ours in food science who was worried about this, right? If wheat manufacturers decide they want to fund a study to figure out to what extent gluten reduces the risk of heart disease, let's say, right? In the way that I just framed that, which is the way that it's been framed in some studies, There's already a bias built in. It's not whether or not, it's the extent to which gluten reduces heart disease, right? If a company with interests, and to Shelley's point, profit-driven interests, funds science with that's directed, teleological, directed to some end, university faculty and students then are put in a position of potential bias where they're expected to produce a particular result rather than explore an issue. And Natalie, that's not what I hear you saying about the Microsoft relationship, which sounds like, and I don't know the details, but open exploration, discovery science. Those
Right.
are two very different models, right?
Yes.
If it really is the case that Microsoft's just like, wow, shoot, here's a bucket of money, go do cool science. Like if something comes out of it, like, the university will own it and we'll patent it and that'll be good for everybody. That's different than
Yes.
go discover this thing that we want you to discover.
Absolutely. I think that goes back to your example of like soda companies funding research in universities about anti-obesity campaigns. That's kind of more in line with what you're thinking, right?
Yeah. So yes. Okay. Good. So what we've done now is set up at least some polls. There's the one, like a private entity funds open science, let's say, or open discovery if we want to couch it in broader terms. Still, that's on the one hand, and on the other poll is they fund something really specific, and there's clear bias there. But the interesting work, I think, now around public-private partnerships isn't about those polls, because we sort of know they exist and there's lots of rules about gift giving and conflicts of interest and all that. It's what happens in the middle. So I want us to think for a minute about, let's have a mid case where, and I'll make it specific. So at UCF, Lockheed Martin, a big defense contractor in Central Florida here, funds lots of undergraduate senior design student research in the College of Engineering and Computer Science. They also hire a lot of our students. Now, this isn't open discovery necessarily because they want to fund particular kinds of discovery, but it's not like directed research either. It's this in-between game, and that, I think, is open to lots of interesting questions about what makes for an ethical public-private partnership. And again, I'm not saying here that the Lockheed UCF relationship is or isn't ethical, but I see it as like a middle ground between Natalie's example and the soda and obesity example. Mikhail, I see your hand. Go ahead.
Yeah, I just wanted to bring an example that I thought was applicable, but I kind of wanted to do my research to make sure it actually is applicable. But it is considered a public-private partnership, but it's towards the military. And one of the ones that I've been following was the Balfour Beatty fraud lawsuits and things of that nature for military housing on a lot of military installations across the country. And I think that's an example of a public-private partnership that didn't go too well.
Mikhail, that's not what I know much more about. Can you tell us a little more details about the partnership?
Sure. So I'm trying to make sure I say stuff without compromising my job.
No, well, yeah, don't get yourself in trouble.
It's public knowledge. It's like I put
Okay.
it up on the internet to make sure I could do it. So the
Yeah.
U.S. military has partnered with Balfour Beatty Communities LLC to provide military housing. And they've been doing this for a very long time, for at least 10, 12 years, I believe 2011. But recently they've come up against some fraud claims. Well, they're not claims, they actually are actually currently in the Senate being grilled and everything for misrepresenting maintenance records and also lying about repairs and defrauding the Air Force, Army, and Navy on different claims like that, and also about obtaining performance bonuses for stuff that they didn't do. And so that's one that's been kind of, because I work for the military as a civilian, that's one of the things that's kind of been on our radar that we deal with on a fairly regular basis to kind of educate our users on what's going on and how it's not necessarily something that we from a government perspective can rectify, because there's a contract in place that determines what can and cannot be done, what can and cannot be asked for by these companies that is regulated by their contract. even if they're not doing it, it has to be done through a certain way and through a certain person. So um, that's kind of like an overview of the situation and how it affects some of the soldiers and people that live in those housing.
Yeah, that's a really good example, Mikhail, and that's different than the ones we've offered previously in really important ways, at least from my perspective. So in the example you're offering, this is a case of small contractors working for large public institutions. So not a sort of even public-private partnership where some massively well-funded organization like Pfizer partners with a massively well-funded, overfunded, I don't know, federal government, a funded federal government, on sort of equal terms to solve a problem. Rather, this is small private organizations working for large public institutions and taking advantage of their smallness to sort of creep under the radar to do things to make money. Again, back to Shelley's point. There's probably lots of examples of those, and those are different sorts of public-private partnerships, I think. I don't know how to work that out exactly, but that's a really compelling example of a difference. I see Steve and Mikhail. If you want to follow up, please feel free.
Oh no, I think it's you're right, you're spot on. They flew under the radar for a long time, and a lot of it goes back to, like you said, their size and also the oversight. A lot of things cannot get the proper oversight because the reason why they hire these people is because they don't have the manpower to do it themselves, and it's a funny problem.
Yeah, there's a relationship there coming back, I think, to Shelley's point about sort of insurance, medical costs and insurance. I think this is in that same bucket somehow in my head. Another example there might be the sort of Florida insurance controversies about roofing fraud claims. These are the same kind of problematic, roughly public-private partnerships. Dr. Kubler, go ahead.
Well, I just wanted to add that in trying to establish the fairness and the equity relationships in any public-private partnership, it's kind of a qualitative calculation, if you will, of return on investment. You know, if there's a private-public partnership and the public money is invested into this, then there's an expectation of some return or benefit to the public. And so then to try to calculate what the benefit is versus the capital outlay and, you know, how much went from the public to the private, one really needs to account for all of the costs. So returning to the Pfizer vaccine, we couched the discussion in terms of the start being the warp speed program, and then said, well, this company maybe gives more return and there's less investment insofar as they went alone to develop the vaccine. And yes, they're reaping back-end rewards in terms of total sales. But I think the argument could be made that long before there was warp speed, there was several decades of research into the fundamental science that is the foundation of mRNA vaccines. And, you know, in speaking with Dr. Moran, you know, he's very quick, to his credit, to recognize that the foundation of their vaccine really is a tremendous amount of university sponsored or university research, which is sponsored by federal funds mostly, and state funds to some extent. And that same paradigm, you know, that same relationship exists even in military support. So you talked about Lockheed, and there's Raytheon and many other big defense contractors who make a tremendous amount of money on sales of arms and defense apparatus. And those benefit from fundamental technologies that often originate in the university environment. What's really interesting is that I have learned a little bit more about this as we've done some of our own military funded research. They often talk about the technology readiness level, which, if you think about a nascent idea, is TRL 0. And as you develop that idea toward a final product that you can pick off the shelf, you climb from TRL 1 up to TRL 10, right? So TRL 10, you're buying it TRL 8 or 9 is maybe the scale up for manufacturing that Lockheed does when they get a contract for, say, something like the Joint Strike Fighter. What's interesting is that in between place, that's between basic research and the final manufacturing, is also publicly funded, usually by the national labs, perhaps in partnership with SBIR contracts and STTR contracts. So all along the way, there's actually a lot of flow of public funds into the private sector to try to take a technology forward. And I guess part of my point is that's initial investment that may not be seen. And that's also investment that reduces risk. So we tend to couch this discussion in terms of risk reward and say, well, look, it makes sense for private companies to have a lot of reward because there's a tremendous amount of risk in the technology development. But it's not necessarily understood actually how much of the technology is developed along that TRL level through public support. And so in many cases, it's developed all the way up to the scale up and the final manufacturing, which is the case with the Pfizer vaccine. So we've got to be careful in how we calculate the costs. Lastly, I would say we can say that, okay, well, we function in a economic/political system where we recognize the need for competitiveness, and there's a benefit to having private companies have reward on their sales, and the public benefits from that in terms of employment. And then when we look at the healthcare sector in particular, people are very quick to point out that the United States has some of the best medical technology in the world. But then I think what you have to do is look at the broader ensemble data and say, well, all right, what are the products of that? How good is medical care in the United States for the general person? And you can go statistic by statistic, and you'll see things like infant mortality rate is actually much higher in the US than it is for European developed nations, despite all of the great technology that we have in medicine and the public funding. The same is true for life expectancy. And so it begs the question, regardless of how we structure private-public partnerships, are they working when you look at this ensemble data and you say, well, there's big losers across the population. So I think there's definitely problems that have to be analyzed. And it's not clear how you would structure those, because to your point, as soon as you set up regulations and new barriers, there is an incentive to find workarounds, and there's a time lag between public response to private sector alacrity in generating economic benefit.
Yeah, so Steve, from what you said and the examples that we've offered so far, I hear two things. One, public-private partnerships are implicit to the nature of technological development. Like, you can't get around them. They're here. They're what supports science, basically science and technology development. And two, regulations can't keep up, right? There's always going to be problems. And regulations also, I guess I would add, also govern big and obvious partnerships more so than they do small and local. So the next question I had on my list is like, what makes for an ethical partnership at the local level, right? Setting aside contracts and like the ways that we handle IP agreements and laws and regulations, like the big federal institutional stuff, what makes for ethical partnerships at the local level for you and for me? And I was thinking here of work that my colleague Nikolai out at the University of Washington had done on gift giving in medicine. And there's been a lot of literature. He's not the only one, obviously, but there's really good evidence that a pharmaceutical rep handing like a single unsharpened pencil with their logo on it to a physician, so functionally, like monetarily not important, influences that physician's decision in meaningful ways. They're more apt to prescribe that company's drug to a patient. And so only in the last couple of decades, there have been really sharp constraints on gift giving in hospital and medical research settings. And we know the important part of that story is that we know that there are these really subtle and really personal nudges, to borrow the term from psychology, that we can give to one another to shape our decisions. And so even if we've got all the regulations we can in place, there's a sense in which if somebody from a major corporation comes to my office and says, hey, can I buy you lunch? Or, hey, let's talk about what you're doing here. Even there's no exchange, just says, I'm this big important person from this company. I want to hear about your research. there already is a nudge there, right? And so the question is like, what do we do at the very individual level? And part of the reason I'm asking is because for me as a philosopher, ethical decision making is still very personal, right? We have these big sort of compliance and regulation apparatuses. My Latin is failing. Out there in the world that are supposed to protect us. But in the end, the decision on the ground day to day is still you and me and those with whom we have relationships. And so if partnerships are a problem, which I hear us saying, and there are regulations in place, there's still that question of like, what do we do at the personal level? Mikhail, I see you. Oh, this might be a residual hand, but your hand is up. If you want to weigh in, please feel free. Residual, got it.
I think, you know, perhaps I don't, you know, obviously this is a more convoluted question than, but on the local level, even though I feel like regulation and just all of those things that we keep in place, like you're right, they put restrictions on gift giving, but then even stuff that are not gift giving, even stuff that is just, hey, talk to me about what you're doing, all of this, these are all sort of, they put these precedents in your head that, okay, yeah, the next time I'm prescribing something, you already have that name lingering in your mind. So it's like easy access to that, right? I think for, you know, the local individual level is making sure that everyone has enough institutional support to stay aware that those things are a thing. You know what I'm saying? Like if I didn't know that, you know, not saying that this is like always comes with malicious intent, like people from like higher up farm companies wanting to, you know, not that, but just staying aware that this is a thing that happens, or, you know, this is a trick that often, you know, people will fall for, or like the lunch or that, like take the lunch, take the all of this, but also you need to make sure that on a personal level, maybe regulation can't keep up, but we as people, you know, we are constantly under the obligation to stay informed. And while, you know, laws can't keep up, maybe we can, if we give people the institutional support required for that.
Yeah, Natalie, you don't know me well yet, but I am 100% on board with what you just said. I have this, I mean, as many of you know, like part of the reason why Dr. Kubler and I wanted the center to be around is that there's a sense in which these conversations stimulate us to do exactly what Natalie's talking about, which is to just think regularly and consistently about this broad landscape of ethics. And here we're talking now, we've gone from the like big picture public-private partnership story down to the very, very local. But at the very local level, I think, Natalie, you're right on. Like it's a matter of staying aware. And we're all pulled in so many different directions that I fear that without regular sort of pauses like these, like this conversation, to think about these things, it all sort of falls to the back burner and we just go day to day and we, you know, we accept the pencil or the lunch, or we get excited when the industry rep comes to visit my lab or whatever, right? And we don't stop to think, well, what is that doing to the direction of my research or the ends of my research? And again, there may be nothing malicious going on at all in any of the examples we've offered. Maybe Mikhail, with the exception of yours. But malice aside, the idea that influence is a thing and it does shape our decisions is good to be aware of. Yeah, I'm on board. Yeah. Well, look, I guess literally solved all the problems of public-private partnerships in a mere hour together. So congratulations, friends. I'm happy to stick around and talk more. This is a big topic, and there's I think this is, I'm guilty of this at almost every turn, but there's lots of really interesting research we could do here in this space too. So if you get interested in this topic and you want to read more, I can send you resources. But I think at very least, as Natalie directed us to, just stay aware of the influence of partnerships and what that means is a really important thing. Sterling, I see you. Go for it.
No, I was just, I probably have more experience, 35 years of being pandered to in a laboratory setting as a clinical scientist. And I recall the good old days back in the 80s when vendors would take us out to lunch. And so this wasn't just like handing a pencil to a physician. This was a whole department. So, and that was, the vendors would be, well, for instance, with this COVID, we're talking about the vaccines, but on my end, it's who provides the best test. And I know for a fact. So at one point, Advent Health, when the pandemic started, and how do we test for this? Orlando Regional Medical Center had no testing whatsoever. Advent Health already had 7 platforms, and Orlando Health was actually sending their COVID test to the competitor, Advent Health, to do the COVID testing. That caused heads to roll, and actually people to be unemployed, that Orlando Health had not done any of the groundwork to get COVID testing in there. But every one of those testing vendors are in there trying to persuade the staff and the department to use their product. We're talking about how quickly the vaccine came along, but usually it takes years for testing to be verified and justified and fulfilled. And this was just popping out, boom, boom, boom. And I recall when we used to be taken out to lunch and pandered to, and now it's companies, kind of the best thing that they do now is provide continuing education credits. You can log on to, for instance, Advent Health, they use Roche Biomedical, and Roche provides continuing education courses. Advent Health's reference lab is ARUP out in Utah, and they provide a lot of education, continuing education courses. So that seems to me to be a justifiable, without having to pay for continuing education. That seems, really nice and easy. Whereas, as far as it's very limited what we get as far as a pat on the back and anything from any of the vendors. They don't do much at all. So I'm not really justifying anything. I just a huge change in what used to. We used to be taken out to lunch all the time back in the 80s and 90s, and now you're lucky if you get a candy bar. So that's just, and that's empirical data on my what I've seen.
Someday a candy bar would change my whole outlook, Sterling. Yeah, it's so it is the case, right, that medicine is the sort of premier example of this conversation.
I just want to add we're running out of time here, but so in addition to this, during the pandemic, restaurant vendors around the area. So I live in Oviedo. Some Italian restaurant would send, basically a whole, like a catered dinner for all the staff, which would be doctors, nurses, and ancillary services. So that, that not really a vendor, but they're trying to drum up popularity in the area and say, hey, who was even if the pizza was better, and people don't tend to have ever tried, this mom and pop pizza place, they were sending food in, and of course we're not going to say no to that. Hey, feed, and they were appreciative. I believe they were. Hey, well, let's feed the staff at the local ER and see where it goes from there.
Yeah. So Sterling, that last one is really interesting to me, because what I didn't have us do is draw carefully the question of intentionality, because there's an argument to be made that during the pandemic, lots of people wanted to thank you and your colleagues in medicine for the hard work you were putting in supporting COVID patients. And so I could easily see a case that the mom and pop pizza joint was like, just out of the goodness of their mom and pop hearts, providing pizza to the hospital staff, right, as a thank you. Now, there's no intentionality for manipulation there, but there's still an argument to be made that there's a nudge there, that implicitly you're going to say, you're going to remember mom and pop Giovanni or whatever it is down the street at the Italian restaurant.
Tomasino's.
I see, there you go. And so there's like a subtle cue there. And again, there's no intentionality, so it's hard to make an argument that there's anything unethical going on intentionally. So, but the consequences remain the same too. So we could talk a
Dr.
long
Beaver,
time about. Oh,
Dr.
go ahead.
Beaver, I thought free donuts for police officers was the American culture of protection racket.
Well, there you go. There's lots of examples of this. Yep. Of course, if I get pulled over and hand a box of donuts out of my window to the police officer, I'm going to get arrested. So it's not a thank you necessarily. I don't recommend it. All right. Friends, thank you. This is super fun every time. In next month, November 29th, we're going to be talking about House Bill 7 and critical race theory and sort of the landscape of politics around state legislation. So that'll be a fun one. And we'll do these every month. So I hope to see you again next month. I'll send out a reminder. Thanks everybody for your time.